Today's presentation is coordination with the Family Urgent Response System, regional centers, and other dispatch lines. So this is one of the trainings to help support the work that you all are doing with the Mobile Crisis Team benefit. These trainings are supported by the Department of Healthcare Services as well as MTAC. So we're really excited today to be bringing this topic to you. We want to also share a little bit about mobile crisis service, and this is just from the bin, but the whole point, as you know, is to provide rapid response, individual assessment, and community stabilization to medical members who are experiencing behavioral health crisis. So as you learned on a lot of the trainings, things like de-escalation, stabilization techniques, motivational interviewing, risk assessment, and then how to coordinate or partner with community entities, which is part of what we're going to talk about today. All of that is designed to help avoid unnecessary emergent department use, psychiatric inpatient hospitalization, and law enforcement involvement. And thank you to those who are already putting your name and everything in the chat. You're one step ahead of me, but feel free to do that now. That's wonderful. And good morning, Jose. Thank you. The other thing we wanted to talk about is just to give you we're doing this in all the beginnings of the slides, is that the whole point of this is to change mobile crisis services so we're more resolution focused. Our objective is to move into our communities to help provide relief to people who are having crises, and then again, help support them in getting resources in the least restrictive means necessary. The other thing we wanted to also share with you is that a lot of what we've been working on and learning through this is built upon several really big pillars: person-centered, trauma-informed, equity-driven, brief interventions, de-escalation and resolution focus, working again from the lens of least restrictive interventions. We want to make sure everything's culturally responsive, linguistically appropriate, and available and accessible. So as we're putting these trainings together, please know that those are all things that we are keeping in mind. Okay, now to the fun part, which is the welcome and the introduction. So my name is Jennifer Hodson. I am a principal consultant through Health Management Associates. So I'm happy to be here today. I've got over 30 years experience working as a clinician. I'm a licensed marriage and family therapist. I've worked in a wide variety of settings, trained and supervised. I worked in higher education for 24 years, delivering a lot of the training content that we'll be talking about today. And if you've had me in other trainings, talked about there as well. So I'm very, very excited to be here today and to talk with you a little bit more about coordination. This is our overall agenda for today. We will cover a lot about coordination with the FERS, regional centers, and other dispatch lines as per the bin. So in the bin, they are explicitly referenced. So we wanted to make sure to deep dive. Then we will break down each into sections. We'll learn more about these services, the supports they provide, and how Mobile Crisis Team can best coordinate with each. They're just each a little distinct and different. We would engage them at different points in time and for different reasons. So we wanted to at least break those out. And then throughout this discussion, we'll think about how we can coordinate with each of these entities from a person-centered perspective. We'll make sure that we're also thinking from a trauma-informed perspective, as well as being culturally responsive. We'll conclude today with a focus on building county-driven infrastructure and some memorandums of understanding agreements that kind of will help streamline these community partnerships so that when we're engaging in transfer processes, it's very clear, or at least a little bit clear, on when we should be doing that, and vice versa, when some of these other entities will want to engage with us. So some of the learning objectives that we're going to cover today are on this slide. We want to really describe the coordination requirements as they're presented in the bin. We want to help you to differentiate, if you don't already know, between FERS, the Family Urgent Response System, so I'll call that FERS just for abbreviation, regional centers, and other dispatch lines, the more commonly used. We'll talk about the value of developing county level plans for coordinating member safety and improving outcomes. Again, applying that person-centered approach to warm handoffs between the mobile crisis team with FERJ regional centers and dispatch lines. And then at the end, we will review the infrastructure elements that will help to streamline those partnerships. We wanted today to also remind you that as we're moving along in the training, we want to reference back prior MTech trainings that are connected with today's content. So there's a long list. So each of these trainings in the left column really feeds valuable content into what we're talking about today. If they're linked, that means that we already have them uploaded and online and ready for review. If it's not yet linked, that means it's in the process of being able to do that. And then we have a few coming up on the 31st of October and one on the November 1st, where you'll see some content in there that can also be helpful with the content we'll talk about today. So the first thing that we're going to do is we're going to launch into talking about coordination requirements. So before we address the opportunities to coordinate with FERS, regional centers, and other dispatch lines, we really need to understand how we got here and why this is so important. First, we'll address the need for coordination and what the BIN requires as mobile crisis teams form these community partnerships. So we'll first take off in a position of going into the bin. So why do we coordinate? Why is this so important? Well, when we think back historically, and this is important that we understand this process, in the United States, we've really struggled to find that right approach to care for the community members who are struggling with mental health issues. From the lack of humane care experience due to institutionalization to the tremendous void of care through deinstitutionalization, our country has really struggled to provide evidence-based, person-centered, trauma-informed, and culturally responsive care for the people experiencing mental health crisis. So for our most vulnerable, we've really struggled with how to meet their needs. And that's why organizations such as NAMI and other consumer advocacy groups have really stepped in. We've had research teams also find evidence of things that we need to really push and advocate for a coordinated, community-oriented approach. And that's really what the BIN is trying to also help us do for persons in crisis. So Townsend did this really scoping review that was extremely helpful and found that there were three, really primary benefits for community coordination. One is, it really reduces treatment gaps. So sometimes, people may contact a source, they might be given a list of things, but there's no follow-up or follow-through. So maybe they tried to call the first one and nobody answered, or they didn't get a call back, or they got scared because they didn't know what to expect. So having a system of care where we're working together allows us to really minimize those gaps. We look for improvements in continuity of care. So how do we really walk with people from one, step to the next as they're working through getting some sort of stability and support and relief from their mental health issues and concerns. And then really minimizing the exposure to police violence for those in crisis. So historically knowing that when some of our populations, particularly our populations of color, our most vulnerable populations, have reached out for help and support in instances where they were met with, extreme force in response to that, we're really trying to minimize those instances by building a coordinated care system in place where law enforcement wouldn't be first dispatched to those settings. So what does coordination exactly mean? Well, we're going to turn to the BIN for this. And the Medi-Cal behavioral health delivery systems, they really talk about a couple of primary things. So the first thing is we really want to be able to coordinate with law enforcement. So this isn't about eliminating any resource. This is about more effectively coordinating with each of them, whether it's 988, 911, FERS, our resource regional centers that we're going to be talking about today. We just really want to build effective processes so that members have the information, not only 988, 911, all those entities have information about mobile crisis teams, which is also in the bin, but that mobile crisis teams have strategies for coordinating with them so that we really have a good sense of, that old adage that just because you have a hammer, not everything's a nail. So we want to make sure that we're really being smart about which one that we're going to engage with so that we don't have people waiting for the right help. So that's what effective coordination is all about. The other thing that we want to make sure is it's really important, especially with our immediate coordinated services, that each county will have different community partners when it comes to immediate coordinated service response. And it is really, really important in this implementation phase and plan that you're all in is to note who and what those entities are so that you can develop those workflows and transfer care. So who are your immediate coordinated entities in the area who you can dispatch, immediate support and help? And that's where we want to look at. So in the bin, some community partners can include, and they have a whole list of them, like medical and behavioral health providers, Indian healthcare providers, hospitals, regional centers, local courts, law enforcement. There's a whole list of them. And immediate coordination with some other crisis receiving and stabilization facilities like sobering centers, crisis stabilization units, psychiatric health facilities. So if our mobile crisis teams are working with somebody and determine that they need another immediate next step in their care, right? Those are entities that you want to know about in your community or where the closest one would be so that we can help streamline that coordination process. So it doesn't create, because as we know, when somebody's in crisis, we have a very narrow window of opportunity to get them to the next level of care if needed. If too much time has passed or too many hurdles are present, that's when we start to see attrition. We see people sort of pull out of follow through. So we want to try to really make sure our mobile crisis teams have this information at hand before they go into the field so they can really streamline and decrease those, gaps in care time if possible. So I want to just pause for a second and invite you to put into the chat, what are some examples of important community partners in your community with whom mobile crisis teams should coordinate? So just put out a few for each of you that are here today. What are some important community partners in your community that you think your mobile crisis team should coordinate with? And are there partners with whom you're not coordinating services and why? And maybe that second is more for thought, like to really think about, okay, we're really engaged with these, but we're not really engaged or coordinating with these other ones. And that might be where your stakeholder meetings come in. Emergency rooms, good. Mental health urgent care clinics, crisis centers, schools, absolutely. Absolutely. Schools are my passion in work. Homeless outreach teams, very good. Emergency food, we're going to talk about all of this in other trainings too. Absolutely. Sobering centers, emergency shelters, you're doing such a great job of other community partners. Great. Absolute shelters, absolutely. So because our mobile crisis teams, upon going out and working with people may discover that there are just some basic needs that the people we're working with also need in addition to their behavioral health support. And it all kind of feeds in together. So coordinating with all these things, adult protective services, domestic violence, absolutely resources. Right, because we move into an environment where we have somebody who's having mental health crisis that is connected to feeling unsafe. So it's going to be a both and. Right. Great. And welcome, Alicia. Absolutely. So these are all great examples of partners and partnerships. And I'll tell you, I don't know about your community, but my community, new ones are coming every day. So every time I turn around, there's a new community resource, a grassroots effort that's being put into place to fill a gap. So this is going to be an ongoing process for our counties where they continue in a routine basis to sort of, review what's happening, what's becoming available in their communities, and then adding that. So now we're going to move into differentiating between our different systems that we talked about earlier. So our FERS, our regional centers, and then other commonly accessed dispatch lines. And again, at any point in time, if you have questions, you can certainly put them in the chat or in the Q&A, and Andrew will let us know. So what is the Family Urgent Response System? Some of you may be more familiar with this, and so you're like, I got this, I know all about this, and some of you may be not as familiar. So this is just going to give us a quick overview. I hyperlinked in at the very top of the slide, that orange. So if you're not familiar with it, I really encourage you. They have a fantastic website. So if you go to the website, there's lots of information that tells you about what FERS is and does, who they serve. And so my overview today will be part of the training, but there's a lot more that you can learn. So the Family Urgent Response System includes state and local mobile response teams to provide immediate trauma-informed support to current and former foster youth and their caregivers. So they too provide mobile response, and we want to make sure you're noting that in part of the resources that the FERS does. This is, again, a statewide system. So we really see, there's a distribution across the state. Of course, there could be more remote areas. So if you're in a county that has pretty remote sections, you want to connect with your FERS system to make sure there is coverage. But the idea is that there's a statewide hotline, there's local mobile response teams. They're available 24/7, 365. So 24 hours a day, 7 days a week, 365 days a year. The thing that they've noted about with their statistics is the callers are connected to a live person in less than 40 seconds. And they provide immediate in-person face-to-face response within about an hour and not to exceed 3 hours in extenuating circumstances. And that's for urgent needs. If it's something that was identified as not urgent but important, then they try to go out the same day or within 24 hours. So they're also going to be triaging those situations that are really urgent. They have an email that I put below as well. So as you're thinking of collaborating and need more information, or maybe you want to schedule a training with FERS to come to your team and talk with them about what they do, there's a really great email address there, and they're pretty responsive, pretty quick. So I encourage you to reach out to them. So how exactly does FERS help? Well, FERS provides a very large scope of services for those that we identify, the current and former foster youth and their caregivers. So they have a family-focused lens, which is really does my heart well as a system relational thinker. They anchor their services, again, in trauma-informed treatment and care, and they work to help prevent foster moves by preserving the relationship between the child, the youth, and their caregiver. So as there are these really valuable foster opportunities for these children and youth, they also recognize that can comes with some transitional challenges. And they want to help keep the integrity of those. They want to help there to be as least amount of transition for the children as possible. So they're heavily invested in trying to help those foster care arrangements to really work. It's really designed to be an alternative to calling law enforcement or 911 for support, which is what people tended to do in the past. And again, like mobile crisis, it's been shown to reduce hospitalizations, law enforcement contacts, and out-of-home facilities, placement in those out-of-home facilities. It really promotes healing as a family, retention of current foster caregivers, and stability for youth in foster care and extended foster care placements. That's the primary goal. So really promoting that retention and healing and providing the right types of interventions and services and supports, um, versus providing more of a remove a child from the situation response, which if you've done intervention work, you know that while it's challenging, if you can help a change, de-escalation in that moment, that actually builds relationship and trust, versus pulling everybody apart from one another and then working with just one person or having to try to figure out how to pull them back together. So if they can go, it's kind of like a bell curve. If they can go up to the point of tension and trust and come down together, they're learning skills and techniques and trust. And that's where these services, as well as mobile crisis, is so effective. So again, what services does FERS offer? They have a toll-free hotline 24 hours a day, 7 days a week. They have caring counselors that are staffing that, already trained in conflict resolution and de-escalation techniques. They really focus on in-home escalation, stabilization, conflict resolution, and then trying to connect them to different support services and resources. So it could be that some additional supports are needed, and that's what FERS does, is goes in, they help assess that situation, and then they will follow up and check in with them. Now, coordinating with FERS at dispatch. So during dispatch, a member or caller may reference FERS. They may bring it up on their own, and that they're aware that they have this service available to them. It's always good to take that person-centered approach, though, and clarify if they would prefer to have FERS respond to their crisis or if they would prefer for the mobile crisis team to go. That's if they bring it up. If they say, oh, yes, I forgot about FERS, they have been really helpful in the past, and then our dispatch can do a warm transfer to the FERS mobile crisis line. They'll remain on the line until they're successfully transferred, and that'll be the extent. However, they may indicate that, they've maybe tried FERS before, they'd like to try something different, and we would dispatch mobile crisis to that location and work with them and see if, when our team is on site, if they would want to be reconnected or sort of helping work through some of the barriers they might be experiencing connecting with FERS. Are there other ways that you know of that our mobile crisis teams can coordinate with FERS optimally? For those of you who have worked with FERS, if you have other strategies or things you know about with FERS that would be important for all mobile crisis teams to know about, I really, really encourage you to put that in the chat. Maybe some of you have worked with them before or have interacted with them before and would love to know other strategies. Okay, so how can our teams support member engagement with FERS? Well, mobile crisis teams can really help do a lot with coordination. They can explain to people that they're working with what FERS offers, what to expect when they engage with them. For those who may not have been linked to FERS before or utilize their services, it's really an important opportunity to maybe explain the benefits, maybe demyth anything that they may have heard that aren't accurate. It could be a part of their safety plan that they reach out to FERS, really help to build out a more expansive support network. So many of the people we care for have very limited support networks, so that would be something else we could list in the plan, which is helpful. It could be that, they just need help making that what we call a linkage. So if it's during business hours, perhaps we help them call FERS together and build that relationship at that point in time. So that could just, sometimes for some people, just taking the first step is the hardest one. So we can also plug the FERS numbers into their cell phones if they would like. So a lot of times some people may not know either how to do that, or they might just be elevated and need some help and say, hey, let's do it together. I can help you put the number in your phone and we could put it underneath something that you'll remember a little bit easier, so that it's easy for access if they should want to use that in the future. All right, great job.
Hey, Jennifer, I did want to flag, there are a few questions in the chat around FERS.
Great.
So I don't know if you want me to just try to read them off.
Yeah, go for it.
So the first one I see here is that is there anything for families that don't receive regional center or are engaged with welfare? And do FERS also support probation youth?
Oh, that's a really good question. I am not a full expert in some of the caveats to FERS, but what we'll do is any questions that we don't have immediate answers to, we will put that together. We'll put a response together for you. I'm not sure about that. I do know that it's a current and former foster youth. So I do believe that would extend to adults, young adults, but we can definitely double check on that unless somebody knows that information and wants to put it in the chat. But from what I read, there wasn't an age restriction that I could see. It was just current and former foster youth.
Perfect. And you segued into the second question around adults who were
Right.
former foster youth. So,
Yeah. Yeah. And so I will double check on the probation youth. And I will double check on the regional centers if they're already engaged with child welfare. I can't imagine why they wouldn't be able to also access that, but Andrew and I will keep track of those questions and make sure we can get a really firm response to that. Thank you for bringing those up.
yeah. And I did want to just mention that Lauren mentioned in the chat that that's correct. There is no age limit.
That's right. I didn't see one when I researched that. So it could be that the FERS will also, if somebody has additional needs, like, that they'll engage in other resources and supports. So if juvenile justice is involved, if justice involved, then they might, but I think they're an add-on in addition to, but we'll definitely double check that. Okay, great. All right, regional centers, we're going to keep moving forward because I want to make sure we stay good on our time, but those are really good points to remember. So regional centers are offices distributed throughout all of California. They really provide a local resource to help find access and support to individuals with intellectual developmental disabilities and their families. So there's 21 found across California, and they have 40 office locations throughout the entire state. So they were established to help reduce geographic accessibility barriers and wait lists due to population density. So these regional centers are really designed to help promote equity and reduce disparities to some of our most vulnerable populations. I provided some links on this page too. So if you want to find out, which regional center is closest to you in your county, definitely you can log in and look that up and give that information to your teams as well, as they might go out into some of the more remote areas and regions, or somebody may be visiting your county that has a crisis, lives in another, and you can this way be able to locate which regional center would be the best for them to access when they're back home. So to be eligible for these regional services, a person must have a disability that begins before the person's 18th birthday. They're be expected to continue indefinitely. So the disability is expected to continue indefinitely and present a substantial disability. And there's a whole code that's written around this, and that is hyperlinked as well. Eligibility is established through diagnosis and assessment performed by the regional centers. So if there's any questions or whether or not a person would qualify, the regional centers would be the ones to make that decision, and they have a whole battery of assessments that they use for that. So they provide diagnosis and assessment of eligibility. They help the plan access, coordinate, monitor services and supports that are needed. There's no charge, which is wonderful for the diagnosis and the eligibility assessment. And then once eligibility is determined, they have a case manager or a service coordinator assigned to help them develop the plan for services. So they really work with their members around what services are available and really help members to get those services. So you can see why it's really important that regional centers are aware of us. They're aware of mobile crisis teams, so that we partner in a way that helps provide the best support to the person at that vulnerable point in their crisis moment. Again, most services through regional centers are free, regardless of age or income. So check with your regional center to see if there's anything that would be charged that would be above and beyond, what you would be aware of. So if there are things, we want to be careful and sensitive to that, that we tell somebody about a service that they would be able to access, not that would come with an additional charge or fee. Okay, so what services are provided through a regional center? As you can see, there is a long list. So some of the services and supports provided are listed on the slide. Again, check with your county's local regional centers to see what services they provide. Counties may want to see if regional centers could be sources of support too for the consultation. So as you know, in the bin, consultation for a person with intellectual disability, developmental disability is covered. So if we do need a consultation, and it is recommended, perhaps our regional centers can be ones that we engage with to identify some consultants that can work with our teams. So that's another reason to reach out to them in your implementation phase so that we can engage with them and potentially utilize them in some of our response. Additional services are on the next slide, or this slide as well. So there are still some more services that can be provided. And again, genetic counseling, as you can see, family support, training, educational opportunities. And I go back to something I said earlier, is it might even be good if we set up a training with our local regional centers to come talk to our mobile crisis teams so that they can learn about it right directly from those that they would be interacting with. Caring for members with intellectual and developmental disabilities. So as the bin is outlined, there are a lot of times people with intellectual and developmental disabilities have co-occurring mental health conditions. They also may experience sensory and communication challenges. So de-escalation in some of the strategies that we're using may need to be amended so that we can really help this individual to de-escalate in the way that works best for them. So when we're responding to a person who has an intellectual developmental disability, we want to also engage their natural supports that might be present. Those might be familial caregivers, personal attendants, as they can also help our teams to know and understand what may work well with this individual. They may struggle with certain smells, certain sounds, certain textures, so certain words. So we want to make sure that we're really prepared as we're moving into those places of working with people to deliver the very best responsive care possible. We do have some trainings that we will encourage you to review if you haven't already done so. There's an MTAC training in cultural responsive crisis care for youth and children and families with intellectual developmental disabilities. We also have culturally responsive crisis care for individuals and families with intellectual developmental disabilities who are adults. So we have one for youth and children and one for adults. So we encourage you to watch those as well, as that can really help you to pull together a really wonderful team in response. So our mobile crisis teams, as they work with and coordinate with regional centers, there's really three main things: is that they're connecting or reconnecting members to those regional centers through referral linkages, that they're contacting the member's case manager or service coordinators to share relevant information as they went out and worked with somebody on a mobile crisis visit, then coordinating with that case manager or service coordinator to kind of help with a plan. And then following up with those members to see if they connected or reconnected successfully. So we still follow up regardless if a regional center is involved. We still want to be the ones to follow up and make sure that they're stabilizing and connecting. Now, the bin requires, as you recall from previous trainings too, is that requires that we do a follow-up check-in within 72 hours of the team's response. So if we do make a recommendation or had done like a linkage, to a regional center and talk to somebody with them on the phone, that there was some plan in place or some movement or potential appointment or resource that they've been able to act on. And if not, then that might be something else we troubleshoot with that individual. If it's transportation, if it's, being afraid, of engaging for whatever reason, that we're able to kind of work through that and talk through that on the phone. So these are some of the things that the bin really encourages us to do when it comes to following through. And then, of course, we want to make sure that we have the members' consent where applicable by law. So if we're going to reach out and do follow-ups, we want to make sure that the member knows that, if we're contacting some other entity on their behalf, that they know or are aware of that. So what other tips or strategies do you have for coordinating with regional centers? And thank you. Andrew did put the links to those trainings in the chat as well. So thank you, Andrew, for that. And if you do have any other tips or strategies for coordinating with regional centers, we really encourage you to put them in the chat. All right, the last is we're going to talk about dispatch lines, and I'm going to move a little more quickly through some of this because I know some of you are most familiar with this, but of course, you have your hot lines and your warm lines, right? So your hot dispatch lines are your things like law enforcement, 988 suicide crisis lifeline, and 911. These are really ones where you need immediate support and assistance. Warm lines are more, we'll talk more about this in the next slide, but warm lines would be like your family violence lines, human trafficking, California peer run warm line, Vets for Warriors, and there are many other warm lines that have been established and set up for special populations or for really distinct needs and groups, LGBTQ community members. So those are opportunities where we can begin to help build that safety network. Not everybody needs the hotline. Some people just need the warm line support. And this just tells you a little bit more so that the hotlines are intended to be used when the person has suicidal thoughts, they have intents, or they have another mental health crisis that poses immediate or imminent risk to them. Crisis lines are typically trained by trained counselors, and they're really focused on keeping people safe in the moment and getting them connected to crisis resources. So an example of that again would be 988, 911. Warm lines are really staffed by paid or volunteer peers that have experience with some of the mental health challenges or circumstances that the person might be calling about. They provide comfort and support during challenging times. I know some states that have had warm lines around infant deaths, so I think if you can identify where these warm lines are that would serve your county's needs, it could really, really help provide that support to somebody who feels like they're alone and struggling with this all on their own. And then California has this really great resource, and I linked it here too, where it has a list of a lot of those crisis lines and hotlines. So hopefully you'll be able to utilize that when you're building out resources for your teams. Law enforcement and mental health crisis intervention. So this is one that, as you'll see with the bin, and we've said this before, just like with hospitalization, trying to really minimize the use of law enforcement for mental health crises. Now, there are certainly times where, we'll need to engage them when there's safety issues at play, but it used to be that we would call them first. So this is a step in the right direction where we're really building in appropriate supports and resources. National statistics demonstrate how frequently law enforcement is involved. And so in 2017, Mental Health America did a study that estimated 10% of law enforcement contacts involve someone with a serious mental illness. So it's really quite frequent, and our law enforcement is really excited about the opportunity to have more support and partnership as well. So for 1 in 3 people, law enforcement are involved in their pathway to mental health treatment. And I'm sure many of you have stories. I've had stories as well. And I've also had some really great stories. So there are some really painful and just horrible stories, but then there are some really also good stories too. So we want to create more good stories about the partnership with law enforcement and the role in their community. And I think mobile crisis can be a part of that narrative. Now, some of our officers have gotten CIT training. The interesting thing that we found in the literature is that, it really places more emphasis on officer training than on building community partnerships and encouraging community ownership. So, what we're doing with mobile crisis, I think, is taking that idea and moving it another step forward and really building out these community networks. And we're really re-envisioning the role of law enforcement. So, the bin is written with the intention that we want to re-envision this role, and we're doing it based on best practice. So if you look nationally, this is really a movement that all of our states are moving towards. With safety always at the forefront, our mobile crisis teams will be responding to people who are in distress, and sometimes where safety is at risk. So if your county has the opportunity to build partnerships where you might have a joint response, if there, is a serious safety concern, they might dispatch law enforcement and you dispatch your mobile crisis teams, and the law enforcement may make sure safety is stabilized and the mobile crisis team provides their services. Or in some counties, there may be instances where the mobile crisis team, the law enforcement is on standby close by, out of sight, and the mobile crisis team goes in and works with the individual. It's hard to prepare for every scenario that'll come in on the phone. That's why, as your mobile crisis teams get more and more skilled through experience, you'll be able to really continuously evolve those partnerships with law enforcement so that you'll find the right opportunity. The one thing that we can't do is have a law enforcement officer as a member of the mobile crisis team, because then that would not be under this benefit. So again, just really thinking as we're moving towards the end of talking about law enforcement, is it is really optimal that our mobile crisis teams coordinate and share information and know how and when to do that. Is really going to be a workflow that we're going to want to prioritize as we're putting in our implementation plans. The bin gives a lot of good direction around some of this, but if law enforcement is involved in transportation is then needed, that our mobile crisis teams stay until that person that we're supporting is effectively transitioned and is leaving the site before we leave. So even if law enforcement is on their way, we stay put until law enforcement gets there, and then the decision has been made that they need to transport that person to another place for their safety, for additional care, whether it's 911, whether it's law enforcement, whether it's another transportation service. We always stay put until that warm transfer has been completed successfully. So again, counties may decide to dispatch jointly or sequentially. One goes and the other, maybe standing back and waiting until it's determined that the place is safe. So you all can decide based on what resources you have. And then, just noting in the chat, what other ways could your mobile crisis teams and law enforcement coordinate to safely resolve and de-escalate behavioral health crises? So if you have other things, partnerships that you've established, that would be great to put in the chat as well, so we can all learn from that. Mobile crisis teams also will coordinate with 988, Suicide and Crisis Lifeline. There may be times where people call and say they would prefer to just talk to somebody on the phone. They don't want somebody to come out in person. And at that point in time, you may decide a warm handoff to 988 would be more appropriate. 988 may also warm handoff to the mobile crisis teams if the person would prefer an in-person visit. And there are some counties, Santa Clara, Kern County, Los Angeles, San Diego, that have pilots or these programs or arrangements, partnerships already in place. So this is really becoming a really well coordinated system of care where we're providing, what the person in need needs most. So I'm really excited about what opportunities there are to coordinate better between mobile crisis teams and 988. And if you have other ideas and strategies, again, we encourage you to put them in the chat, because we will keep track of all of this. When we look at coordinating that infrastructure, one of the most important things we're going to put together are these memoranda of understandings. These are agreements that really help us to make sure that all parties involved are aware of what needs to happen. So these can be in situations where 988 needs to be engaged. There's an urgent medical issue, maybe naloxone was administered and the person needs immediate attention. There may be other examples where 911 needs to be engaged during a visit. So this is another service, much like 988, law enforcement for immediate dispatch, where we're going to have 911 as a critical community partner. And that, again, we remain in contact with that member until that warm hand transfer or transfer of care is successfully completed. The infrastructure is really, really important as well. It's recommended that counties develop their implementation plans that include coordination with these 988, suicide crisis lifelines, local law enforcement, 911, FERS, regional centers, and other community partners. That they engage in these stakeholder meetings on a regular basis to really reevaluate their plans, see if anything's changed, if it's working, not working. So there at least is some routine in place where you're able to know, okay, we're going to be revisiting this to tighten this up. We want to also bring them in to talk to our mobile crisis team so they get a better understanding of what happens when somebody calls 911, what happens when we engage law enforcement, what happens when we, transfer somebody to our a FERS mobile crisis team, if that ever would happen. So we're able to explain to people what they can expect. And then we would like to know who are the contact leads at each of these places in the event that we need to process an experience that went really well, or maybe something that could have gone a little bit better. And then evaluating again these implementation plans routinely and getting stakeholder input and from our own teams as well. So what are our mobile crisis teams saying? What is our dispatch saying? That we're making sure we're not only, listening to our community partners, we're also checking in with our own teams. These memorandum of agreements are really, really important, again, because they really help us to better connect to our different systems of care with some common understanding. So it might be that, for example, they've got new team members coming in who maybe a new leadership coming in. So these agreements can be reviewed so that they understand and know these are practices that have been in place for a while. Sometimes when we have new people coming into a system, they bring in different ideas and it might change. And then that sets into motion a whole lot of confusion. So these agreements are really good to revisit. They're really important to introduce to your leadership changes, to your team changes, so everybody always stays on the same page with how to best coordinate. We provide a sample to you. It's redacted from one that has been used between a crisis center and a community partner. There's also a link. So if you're not sure what these can look like, we definitely have tried to at least lead you in the right direction. There may be other counties that already have some in place that would be willing to share as well. And during office hours is a great opportunity and a way for people to also engage with other counties to find out how and what they've learned about those agreements. Are there any challenges to establishing this mobile crisis team structure that any of you might see that you want to put in the chat? I know Andrew's been putting links. Oh, Daphne said we have a hotline and county-led integration work group that has representatives from law enforcement. So we're soliciting and incorporating their input into development of our SOPs. Excellent. Excellent. And, I really find that if you engage people on the ground floor, they're more likely to buy in than if we engage them later in the process and they feel like they haven't been able to be a part of the creation of it. So engaging them early. This may be good. Thelma might mention this back to when you're engaging people, consider symbols or different that may be exalted or de-escalate activities and people. Okay, good. So it could be religious symbols, could be lots of things that either escalate or help people de-escalate. Okay, great things. All right. So just as we kind of move toward concluding, and I want to make sure we have a few seconds for questions as well. This is just some of the things that we want to leave with you on is that community partnerships are extremely important. As noted in the bin, FERS, regional centers, law enforcement, and dispatch lines, these partnerships are important. They also need to be in compliance in order for the benefit to apply. So that's why having these stakeholder meetings, memorandums of understanding, implementation plans are really, really important around these entities. During dispatch, if the caller indicates that they're a current or former foster youth or caregiver to a person in crisis, we can ask them if they've used FERS previously for crisis care, if they'd want to be transferred to them, they want to continue with us providing the service. Either way is fine. Sometimes when people are in crisis, they're just not sure who to reach out to. But we don't actively ask them during discharge. If they are a current or former foster youth, we only would act on that if they brought it up themselves. Okay. If mobile crisis teams do receive information that a member is receiving services from, a care manager, we really do partner with that person's care manager so that we can coordinate referrals and follow up. Also, always observing and being consistent with privacy and confidentiality requirements, but we want to close those gaps the best we can so that there's continuity and follow up, creating those memorandum of understandings, mobile crisis teams, again, remaining with that person and on the line until there's a successful warm transfer. Counties will need to describe in their plans details of how they're going to be coordinating. So that is something that we're going to be looking for in those plans, that you've done that, thought that through, especially with those hot immediate transfers. Okay, and then these are just some resources that we put in place with links. Some were mentioned in the presentation already. Some are also in addition. So if you have any, need to double check on some of these things to make sure that you've engaged with them in your implementation plan, I really encourage you to go through these resources and make sure that you put these into consideration. We have 5 minutes left. Are there any questions that you may have at this point in time on information that was shared in the training? Andrew, I don't know if you've noticed anything and you want to.
There was one question in the chat around the regional centers. Would we need to obtain ROIs from family to speak with regional center? I feel like the regional center would want that.
Yeah, absolutely. So if any point in time, it's not something that would bypass a release of information according to statute or best practices, then absolutely ROIs are critically important, because that's where our agency is for the people that we're serving, that they know where their information is going. So unless we're protected by law in bypassing consent and release of information, you want to make sure those agreements are in place. Absolutely. That's a great point. Hey, any other questions? You all have been amazing today.
There's another question in the chat. Is there a point of contacts for 988 centers to have discussions on coordination of care? I'm having a hard time locating a point person for our nearest center.
Okay, we'll see if we can work with you in helping. Andrew, please note that and see what ways we've been most successful in being able to help people to build those partnerships. I think it might be different depending on the county. So we'd like to support you on an individual level. So please let Andrew know. Andrew, please capture that and we'll make sure we try to get back to that individual. All right. Excellent. Well, we know time is moving through quickly. So I'm really grateful to have spent this time with you all today. I hope that it was helpful to you. We continue to get better and better with how we're able to apply this benefit because of your input and involvement. So thank you so much for your time today.